Hello, and welcome to Building Resilience and Advancing Health Equity Experiences from the Intersections Initiative. I'm Sandra Vieira, Associate Program Director at Prevention Institute, a national nonprofit focused on upstream prevention, health equity, and racial justice. Prevention, resilience, equity, upstream, impact, trauma, these are all terms that surround us in this time of devastation and uncertainty, but they were critical realities prior to COVID-19 and will continue to be so post-COVID-19. In communities across the nation, Black, Indigenous, people of color, and low-income communities have been standing on the brink of economic catastrophe before March of 2020. And this last wave of pandemics have certainly revealed the fragility of our systems. In California, under the leadership of the St. Joseph Community Partnership Fund, and with the support of Prevention Institute, the Intersections Initiative was launched in late 2016 to advance prevention and resilience efforts in diverse communities across the state. The Intersections Initiative is a 4-year, $6 million initiative across 7 sites in California, including Eureka, Sonoma, Napa, the High Desert, Anaheim, Central Orange County, and South Orange County. In each site, the initiative supports a multi-sectoral partnership involving the local Providence St. Joseph Hospital, community-based nonprofits and leaders, county departments of health, school districts, and other stakeholders. The partnerships explore and address how inequities within their communities and environments are tied to root causes and think about policy agendas and partnership approaches to address those root causes of inequities in the long term. As core principles and guiding criteria of the initiative, we have made certain that upstream community prevention is at the core of the strategies and any corresponding efforts, that the hospitals and the hospital ministry plays a central role in advancing key efforts and advocating for change, that residents have prioritized the issue area and strategies through other platforms and mechanisms like neighborhood plans, community health improvement plans, community health needs assessments, and that resident leadership is connected to the Intersections efforts, that a core set of partners lead major efforts and work with broader networks and stakeholders, and that ultimately it builds momentum for broader community change at the regional and state level. Here's a snapshot of the Intersections communities across the state of California and across a range of different social determinants of health, including housing, civic engagement, economic development, education and economic opportunity, as well as community resilience. All 7 sites are anchored by our guiding frameworks and tools, the Adverse Community Experiences and Resilience Framework, as well as the tool for health and resilience in vulnerable environments. And the main point of these frameworks are to ensure that we are not only addressing individual needs for services or programs, but thinking about how trauma and resiliency can happen at a community level and ensuring that health, safety, and well-being are available for all and for all generations. So we're excited to explore this together with our featured speakers. I'm going to allow them to introduce themselves in just a moment. But I wanted to share that this has been a collaborative and communicative initiative, and that we're excited to share the experiences of Intersections initiatives with others and to hear about how it resonates with the work that others are doing across the nation. Today, we'll be hearing from our close partners, allies, and friends, Jason Laksamana of the St. Joseph Community Partnership Fund and Dorothy Stengel of the Community Leaders Coalition, backbone organization of the Napa Intersections site. So welcome, Dorothy and Jason, and I'm going to take some time to say hello and to ask you a few sort of starter questions and then see where our conversation goes. So Jason, welcome, and thank you for being part of today's session. It's nice to have you on here.
Yeah, it's always great to be talking to you and just working together.
And we have worked together now coming up on 4+ years. And it's been a great pleasure to be able to, co-design, co-shape, and co-facilitate this initiative with you. And Jason, you've served as a senior program officer at the fund for several years now, and you've been part of many efforts to improve health and advance justice in communities across California and beyond. You've been involved with things like emergency food and shelter initiatives, community building initiatives. Thinking back to sort of our early time together in collaboration in late 2016, why was the idea of Intersections Initiative appealing and important to you?
Yeah, it was, time flies, 4 years, 4+ years. And actually it's been longer than 4 years because we spent a bit of time researching and designing and seeing what we wanted to do with this initiative. And coming from a health foundation, a lot of work that we had done, a lot of work that was being done in the field, had explored systems of care, had explored increasing access, and certainly working on things like determinants of health. But what we were seeing was that definition of social determinants of health was being applied utilizing a clinical care or a supportive service angle, and less on what we really believe needs to be the focus, less on equity and justice, social justice. And so we wanted to work on something that would not just create more services for the community. Obviously, that's important and it's needed in many places, but really getting to what the root causes, a phrase that we hear a lot, but what the root causes were, and actionable strategies that community groups, a community collaborative, and a hospital and health system could work on together. We know that there is no or was no playbook for that. There was no roadmap, or there was no prescribed measures. There was a lot of theory. There was a lot of ideas. But for us as a foundation, this is an opportunity to invest and provide funding and provide resources to explore what that could mean, what it could mean for the community, the realities of working together, of forming a collaborative or pivoting a collaborative, an existing group to work in this area. But it also provided an understanding of what a meaningful role for the hospital and the health system could play. And not just play, again, in service creation, but play in what does it mean to work for upstream change? What does it mean for these partners and this partnership to form with an eye towards advocacy, with an eye towards true systems change? And so I've been happy to work with Prevention Institute and actualizing and putting into motion some of the models that Prevention Institute has been working on and sharing. And I've been really excited and honored to work with groups like Dorothy's in various places across the state, all very different areas, but from that, generating lessons and learnings that we can continue to build off of in those places, but also share in other places so that these efforts could be replicated.
Absolutely. And I think it's been, quite an experience, and us, building those pieces together. And I think together too with the communities who know the opportunities and challenges the best and are best positioned and situated to move things forward and to make sense of a lot of things, including the chaos that can sometimes be layered into our realities, as we've experienced, this year, but in other times as well. Dorothy, I think about the work that you are helping to lead in Napa, and how the focus of your group has been around ensuring that civic engagement is at the core of any upstream prevention strategy, and that we are building efficacy and power so that we can continue to move for upstream goals, health equity, racial justice, no matter the issue, no matter the social determinant of health. So I would love for you to share a little bit more about yourself, about the Community Leadership Coalition, and the community of Napa as well.
Yeah,
Welcome.
well, thanks for having me today. I'm Dorothy Stengel. I'm the director of the Community Leaders Coalition here in Napa County, and I always appreciate the opportunity to talk more about our work. Napa County, for those that aren't familiar with our region, is kind of your tale of two cities, if you will. We have a world-class tourist destination and all of the amazing things that come with that. But on the other hand, we're home to a substantially underserved and underrepresented population. We're a relatively small county, and over a quarter of the people are living below 200% of the federal poverty level. And that was before COVID. So I'm sure that has substantially changed with the effects of COVID on our tourist industry. And we're in that funny place of we're not urban, but we're not rural. And how does that play out? So, you really don't have to look far to see what disparity and equity really looks like and how it plays out in people's daily lives. And another element is that that Napa has been disproportionately, I would say, affected by natural disasters in the last few years. We had the earthquake in 2014, fires in 2017. Just this month, two significant fires, of which we're just learning just about the destruction and disruption to people's lives. And there's another red flag warning in effect as of today, that going into next week. So it's just really a new reality for us. And that brings me to why community leaders came together, and the Community Leaders Coalition, or CLC, if you will, has a mission to mobilize leaders to really collectively advocate for the needs in our community, especially of vulnerable populations. And, today we're a coalition of over 60 nonprofit, government, faith-based, and private sector representatives. And, initially it was formed rather informally of community leaders coming together after the 2016 election and realizing the policy environment might change for how we better serve the community, and saying, equity is a huge problem. One disaster is compounding another, whether it's man-made or natural. So how do we do this, and how do we really increase our collective capacity to have an impact on social determinants of health? And how do we stay upstream when we're constantly being just reactive? How do we build something that gives us the opportunity to actually catch our breath? And I think, the CLC started about a year before intersections kind of came on our radar, and really informally, just by the will of people's passion around doing this work. And when we learned of the Intersections Initiative, we said, imagine if we could really take this to the next level. We knew we needed resources for that, and we knew, and not just financial resources, but also just a new network and relationship that allowed us to, policy and advocacy is not what we're experts in. We're experts in the community and what the needs are. And so we just needed those additional relationships to boost us to the next level. And I would say we're definitely there, and excited about some of the work that we've been able to do upstream.
That's a great overview, Dorothy. And I think pointing out some of the roots of the CLC, informal originally at the beginning, but passionate and also committed to addressing gaps, in terms of looking at the root causes of things. So I'm curious if you would share with us a bit of the strategies that your Intersections partnership has engaged with over kind of the first few years of the initiative. And then I think we'll talk as a group of what's changed in the last 6-7 months or so. But would love to hear more about some of the specific work that the CLC is doing under Intersections.
Yeah, and I would say none of our coalition, I think I mentioned this, none of our coalition members are professional lobbyists or advocates. We're just people who care about the community. And there's been a lot of growing and learning. And sometimes we've been right on the mark with our approaches, and other times we've learned hard lessons about what being an effective advocate even means. I think at the high level view, some of our successful strategies have really been to expand our network, which I credit a lot to our involvement with Intersections, building relationships at every level, electeds, community members, locally, regionally, always taking into account what we've achieved and learned and building that into our next approach, which I'll talk about in a little bit in relation to some of our work around voting, and really focusing on the collective capacity of how we do it. Some of the key areas that we focused to date have been with underrepresented voters, immigration, open and effective government, and the census really as it relates to civic engagement strategies and building partnerships. I think a few accomplishments that have come out of that approach. Include directly being able to influence how the Voters' Choice Act was implemented in Napa County, really ensuring that underrepresented voters were prioritized and listened to about how to make voting more easier and more accessible. So, for example, where drop boxes are located, how voting systems for people with disabilities are accessed and utilized. And I would say another kind of accomplishment that's come out of some of this has been our work in open and effective government, because as a coalition, we've really tried to learn more about how local government prioritizes and implements policies and resources, and been able to mobilize community leaders around some of those processes. Because I think, what we really set out to do was, we know that our influence at the federal and state level is not as great as it is locally. And we really have the opportunity locally to focus on, what does this look like for us? Even if we can't control some of what's coming out of the federal or state government, we can control how it's implemented in some ways in our community. And we can also strategize and advocate for how we think that best will affect the lives of our community. And so I think that's been a really important part of trying to stay as local as possible um, in some of this work. And so back to the open and effective government piece, we've really been able to say, how can we involve our community members to make sure upstream priorities are being addressed within county government. And that means within the county strategic plan, within that it shows up in the legislative platforms and other policies, which I think will hopefully transfer into how resources are prioritized and allocated. And, the work is hard, and especially as inequities just seem to grow in front of our eyes. And we've learned, I think, that little steps are important. And something seems like a really small win, but it's actually a really big accomplishment, because behind every small win, I think it's relationships have been built, doors have been opened, credibility has been strengthened, and it's a step in the right direction. We're not going to address systemic issues overnight or this year or next year. Um, so it's really the challenge of keeping it going and not getting pulled downstream.
Absolutely. And I think the ways that your collaborative and your partnership has looked at the sort of evergreen and sort of foundational tools like budget advocacy or open government and governance is really important, because those are the things, as you were saying, that can really think about how resources are allocated to different priorities. And there's importance to that, there's power to that, and that's part of what we know can really support health and well-being in the long term. I was thinking about the fact that the last time the three of us were together physically in a room was in February of 2020, where we were talking about how we were turning the corners, we were helping to move the conversation from downstream urgencies, pressing needs, and sort of finally getting into a space where systems change, policy change, the braiding of different social determinants of health were kind of there. And then a month later, the world changed, our world changed, our communities, the disparities and inequities were really even more so revealed. And I think, Jason, you and I kind of held our breath for a number of reasons, but one of them being like, what if this is the end of an upstream focus and a systems change focus and on looking at policy as a vehicle for change? So I'm curious what you experienced in the early months of COVID-19, and then layering that on to the momentum that is really continued and has continued to be built over the summer related to the calls for racial justice that have stemmed from the murder of George Floyd. And so suddenly we were kind of dealing with the COVID-19 pandemic, but then this pandemic of racism and oppression in our communities fully coming to light. So tell us a little bit about your experiences in your role as a funder, as a strategist, as a partner. Like how did you see opportunities and challenges come up?
Yeah, I guess looking back to February, March, it's a little bit naive to think that, I think back then the thought was, let's just make it through the summer and we can return back to normal. And since then, I've heard terms like new normal and the like. And what I've been telling folks is, there's nothing normal about this. This is our new reality. But within that reality, there is this greater need that's been brought on by the pandemic. Certainly in the early months, there was a rush to support public health efforts, to support increased screening. Since then, we've seen much more need fall in both health that have been brought on by COVID-19, actual health needs, but also economic needs that have impacted communities. And unfortunately, the belief and the feeling is that those are needs that we will be continuing to address, not just for the rest of the year, but for the next few years, maybe even a generation. So as a funder, as a grant maker, as a representative of an institution in the community, especially a health-focused and a health system institution, there is this desire, there's this need to meet the immediate emergency, to meet the crisis. And yes, that's important. And yes, that's what we will do. Various investments we'll make will try to address some of that more enhanced and increased need from community members, from community groups. But when you look at a disaster like COVID-19, which it is, it's not just a pandemic, but it's a disaster that's affected our community. Those who have been affected by disaster were often struggling before. We're often in need before, whether it's marginalization or oppression or suffering from extreme disparities. The disaster of COVID only exacerbated that. And so, yes to meeting the immediate need, but we've been using the phrase yes to meeting that need, and still focusing on the drivers of that inequity, the drivers of why those folks in our community have been disproportionately hit and affected by COVID-19, how the pandemic continues to wreak havoc with other issues like housing and housing insecurity, food security, education, and the disparate effects of the internet access or lack of internet access or remote learning on various communities. These are all issues that you take away COVID-19 that our communities were dealing with. And so our foundation and many foundations have realized that we need to do more than provide funding for services that meet the challenge of the day, but really couple that with creating a base to operate from that will meet the challenges that are to come and are meeting the challenges that our communities have been facing for years, decades, for centuries, when we look at the issue of racial equity as well. So when we looked at our work in intersections, it was a 3-year initiative, and it was supposed to end this year. It was supposed to end towards the end of 2020. And looking at where we were in March and April, and seeing like, oh, we need to shift. We need to have some leeway in our attention on the immediate needs. We applied that yes and focus. Yeah, okay, let's make some accommodations and some acknowledgement of this new reality. But why shift everything? In fact, it was a need to preserve what we were doing as a collaborative, what we were investing in. And looking at the 7 sites across California, we realized that they were really well positioned. They were positioned to tackle both, to be that conduit, that convener, because they were a collaborative, because there was many different partners, both nonprofit and the hospital, and in some places, county government and city, that they were in a position to be a hub of activity to meet that immediate need. But because they were also a hub and they were seeing the immediate need, they're in a position to advocate, and they're in a position to operate to meet these root cause challenges of the pandemic, but also in this continuing struggle and this continuing movement for equity, for racial equity and justice. It takes more than just services to fill and to solve the ills of our society. It takes a movement. And when you look at intersections, what we are trying to build is a movement. What we're trying to support is that movement that may already have been in those places, but the intersections framework provided a table to continue to strategize, to share resources, to meet the challenge. And that movement turns into power building. And when you strip it down, that intersections itself was not just an avenue to get more services or even to pass a few policies. It really was about enabling community voice and uplifting that voice and building power in those communities. So intersections was and is the avenue to do both of those things, meet the immediate challenges and address the systemic challenges. It's what we envisioned it to do. And even though we had thought we would end and look back at the 3 years and say, look at what we've built, we've made the commitment to continue because these 7 sites are in that position. So absolutely, this is the time for foundations like ours to continue to invest in building that community voice, to build up that community capacity that results in power. And I see much more work ahead, but I think it's building off of that capacity and that work that we've done over the last few years.
Agreed. I think it felt too important and too pivotal of a moment to pause or to sunset some of this work and the momentum, but really as a way to continue to fuel the approach and the actions. And I will say, you know, Dorothy, in our conversations over the last few months, I think Napa was one of those communities that really stood out to us as sort of saying, there are opportunities that we can move forward, including sort of in certain places, in certain sectors, calls for racial justice, calls for health equity. And I think that was coming up in Napa. So how looking ahead, what are you thinking about in terms of upstream prevention, thinking about resilience as it relates to wildfires, but also racial justice? What's next for the Napa intersections effort?
You know, I think COVID has shown us, as with everybody, exactly why it's so important to stay focused at the systems change level. It's had a devastating impact on our county, and but just with as with our previous disasters, vulnerable populations are disproportionately affected. We learned in the 2017 wildfires that disasters don't discriminate, but response and recovery efforts do. And that has just been perpetuated again by the pandemic. And I think with immediate needs and increasing resource and the more limited resources, it's been significantly challenging to engage with local government on upstream issues because there are so many immediate priorities. And I think as a coalition, we've said, we have to take bold actions and keep the lens on creating resilience by really looking at root causes, because otherwise we're going to, be in this cycle each time a disaster happens, and they are kind of seasonal now for us. And we just can't do that. We don't have the capacities to maintain that. And I think, fortunately, because of the foundation that we built over the last few years with the supportive intersections, we didn't have to pivot much from our priorities on how we approach advocacy. I think, in fact, much of the relationship and capacity building that we've done over the last 3 years has really enabled us to influence local COVID response and how that plays out in addressing immediate needs. So, I think that by intersections has kind of provided a space for us to stay upstream, I think, which has been really helpful, because a lot of the folks in our coalition are the folks that are also out there providing essential and immediate services. And they also need the space to say, let's talk about this at a systemic level. And I think that's kind of what, the space that the CLC has been trying to hold. And I think of one example of what that looks like on the day-to-day, I would say, is our partnership with St. Joseph Health Queen of the Valley has been really instrumental, I think, in how COVID relief has played out in Napa, because their government affairs folks have been able to help us navigate, like, the everyday, the policies are changing and the landscape is changing and resources are changing, and they've been able to help us navigate at the high level what that means and how we can interpret it locally, and because that's a capacity we don't have, and also that we could just never stay up on. And so I think that just kind of goes to, we've built something that we need to continue, and it's just even more important, and we've positioned ourselves well to help folks that are doing the immediate work better advocate for what they need, while we can kind of keep the high level picture on, what changes do we need to be seeing in the system and process for it to really address. And I think with the racial justice work is the same thing. I think that we've it's been amazing to see how empowering it has been for people. And there's this thing we call Napa Nice, and everybody's just nice and polite. And it's been so great to see people like the Napa Nice folks out there on the streets supporting Black Lives Matter. And I think it's a real opportunity for us to also align with some of those real grassroots, I think especially youth-based movements that we're seeing locally, and align with that and say, all right, together, you have this crazy passion and energy, and we've kind of built these relationships and foundations for being able to translate that into what it looks like at local policy level. And so let's run with that. I think the time is now. And the city of Napa, for example, just passed a resolution declaring racism as a public health crisis, and the city of St. Helena is voting on the same tonight. So I think now we have the opportunity to really say, what can this look like countywide? And it aligns to some of what we've done with our work around strengthening immigrant families and the respect and social inclusion lens that we've really been working through. So I would say we're well positioned, we're eager, and yeah.
Well, that comes shining through both the positioning and the eagerness. And I think, that deep commitment to root causes and to making change possible for the communities and residents that have really not had access to justice and well-being for so long. And I think that's something our three organizations share in common, something that the three of us work together to do. And I'm really excited to continue to do that work into 2021 and hopefully get the opportunity within that time to continue to share the story. This is a snapshot, you know, up until this moment. And as you're saying, things are happening hour by hour, day by day, and we're all committed to kind of seeing the upstream approach happening. So I'm going to thank both of you for just sharing some of your insights and experiences from the Intersections Initiative. And as Dorothy said, we're going to keep running and keep going and keep doing this work. So thank you to you both.
Thank you.
Thank you.